everybody. This is Dr. Brett Talley Daniel, MD, neurologist and headache doctor. And today I will be talking about the question, do occipital nerve blocks help migraine? Well, migraine is a trigeminal nerve cerebral artery problem with inflammation of the trigeminal nerve and the cerebral arteries. The migraine process produces the neurochemicals CGRP, neurokinin A, and substance P, which produce the inflammation. The nucleus caudalis in the brainstem is also activated by the migraine process, and its fibers go to the back of the head on one side in the C2 distribution. C2 fibers go into the occipital nerve. Persons with chronic migraine, which is defined as at least 15 headache days a month, 8 of which have migraine features, commonly have pain in the back of their neck or head due to stimulation of the C2 fibers. Persons with episodic migraine may have headache that starts in the back of the head or neck on one side and then comes forward to behind the eye or in the temple on the same side of the head. So here's the question, do occipital nerve blocks help migraine? Occipital nerve blocks have a long and successful history of helping migraine patients. Steroids and or local anesthetics are injected near the greater and lesser occipital nerve in the back of the head. The injection blocks pain signals and reduces swelling and inflammation in the back of the head and neck, and is helpful for treating chronic headaches in this area. Related questions, what are the indications for the injection? And they are occipital neuralgia, migraine, which hasn't responded to conservative treatment, post-lumbar puncture headache, cluster headache, or cervicogenic headache. Where is the injection given? Well, the patient is conscious during the procedure. The doctor uses a 26 or 27 small gauge needle attached to a 1 cc syringe and injects in the back of the head at the level of the ears about halfway from the center on one side. Specifically, the injection is given at points of the greater and lesser occipital nerves down to the periosteum of the occiput. The occipital nerve is between 8 to 18 millimeters deep. The injection is usually given on the side of the worst patient complaint of headache. Like if patients having right-sided headaches, will be given on the right side, but it will work if given on either side, and also work for patients with pain on both sides of the back of their head. The picture that is associated with this on my blog post shows where the injection is given, and you can see that on www.drmigraine.com. What's injected? The doctor injects cortisone for anti-inflammatory effects such as methylprednisolone or triamcinolone, and long-acting local anesthetics such as lidocaine or bupivacaine. Studies have been done comparing clinical results using only a local anesthetic alone and a local anesthetic plus cortisone drug, and both injections seem to work really well. What about patient allergies to the cortisone injection? All patients should be queried regarding allergic reaction to cortisone drugs, and cortisone allergic patients should not be treated. Where is this treatment performed? The injection is usually given in an exam or treatment room in the doctor's office. It's not a big deal, and the side effects, which will be discussed later, are few and mild. Usually a small injection of one of the anesthetics is given first, and the doctor will wait about 5 minutes for the medicine to work and numb the spot where the full injection will later be given. There's usually no blood loss and no need to use a Band-Aid or dressing after the procedure. The patient may sit up or lie down on one side with the injection. How long does the procedure take? This is a simple, quick outpatient procedure, much like a dental injection of lidocaine during dental work, just to numb your jaw, and it takes just minutes. How long before resumption of normal activities? After the procedure, the patient is not usually observed in the office, and they may leave and have no problem driving themselves home and performing normal activities afterwards. How long does it take for the treatment to work? The treatment results are usually very quick, like 15 minutes or so. What are the results of occipital nerve blocks? A recent study found that 8% of patients experienced significant or moderate decrease in pain. Long-term statistics are needed, but the general experience in neurology and headache work is these blocks are usually effective. A second injection may be given to patients who respond well initially. This is usually done or offered several weeks after the first injection. How long do the effects of the nerve blocks last? It's normal to have numbness at the local scalp injection site since local anesthetics produce this. The numbness is like that which occurs with dental procedures, and the duration of the numbness is 3 to 4 hours. Beneficial effect from the steroid takes 3 to 5 days. Pain reduction may last weeks or occasionally several months. What are the side effects of an acceptable nerve block? The most common side effect is injection site pain, which is short-lived. Other side effects include temporary, 6 to 8 hour symptoms of bleeding, dizziness, weakness, and lightheadedness. There's a slight risk of injection. So this is the end of my dictation on injection cortisone and xylocaine top medicine in the back of the head for occipital nerve blocking, which I use mainly in the office for patients with chronic migraine who haven't responded to conservative therapy. It works really very well, and it's a simple thing that can be done. You can follow me on Podbean for other podcasts, and I'm also present on drmigraine.com and on YouTube. So God bless all you patients who have severe migraine, and I'll see you on the next talk.